Hi, this is Jennifer Dickinson.
And I'm Chris Dameyer from Dallas Emergency Medicine, and welcome to our 5-part series on billing and coding, the reimbursement basics for emergency physicians, and what you need to know.
In Part 1, we'll review the exam codes 99281 through 99285 and medical decision making. At the end of this review, you should be able to explain the required documentations in your H&P for a comprehensive 99285 chart. And you should know the level of complexity needed in your medical decision making.
So Jen, when do you learn this stuff? And what do I need to know and why should I even care?
Well, billing and coding for emergency physicians is a lifelong learning process. For now, we'll just cover the basics. Why should you care? The simple answer is money. If you work hard, you should get paid for it.
A good foundation in billing and coding should allow you to document efficiently and get reimbursed for all your hard work.
After I see a patient, how long does the whole billing process work?
Well, Jen, after examining a patient, you can't just send the patient or their insurer a bill. You have to send a specific code. These codes are defined by Current Procedural Terminology, or CPT. The American Medical Association has maintained and updated the CPT code since 1966. Your documentation then allows a certain level of a code to be applied.
So you need codes. And here they are. And though emergency medicine uses many other codes for procedures like suturing and intubation, we can start with these to lay down your foundation for billing and coding.
Of course, you want to know how much you're going to get paid for these, right? It turns out each level has been assigned a value. Those values are known as RVUs, or relative value units, and here they are in a graph format. But how do we convert RVUs to an actual dollar amount?
It turns out the U.S. government assigns a dollar value to an RVU every year for Medicare payments. The 2019 value for one RVU is $36. So you can think of $36 per RVU as a bottom line or starting point. And other insurers will contract with your EM group for each CPT code you bill for, typically higher, maybe about twice as high, than Medicare. To simplify, here is a chart format. With the CPT code, brief explanation, RVU value, and the approximate dollar amount you would be paid if your patient has Medicare. We will review other procedure codes like suturing and intubation in another video, but for now, let's concentrate on these basic examination codes.
Focusing on the EM codes 99281 through 99285 is important, since about 85% of your charges or revenue will come from these 5 CPT codes. Your critical care charges, submitted as 99291, are typically about 5% of the total, though that slice of the pie can vary because of practice locations and severity of illness in a given community.
Now you know that most of your money will be earned by these 5 CPT codes, 99281 through 99285. But what differentiates them from each other? Let's look at those factors, which is dependent on your documentation of your work. 2 main areas determine the level of service, your H&P and your medical decision making. Think of medical decision making as your lab, imaging, and treatment orders, and that will carry a lot of weight. But first, we will look at the H&P requirements.
A very simple presentation or exam will require minimal involvement and work, and your H&P documentation can be very brief, resulting in a 99281. These encounters are uncommon in an emergency department with typical acuity.
Most patients will fit into the 99282 to 99285 level of work. Therefore, it makes sense to familiarize yourself with the details of higher levels of documentation required for the typical levels of work and higher levels of acuity that you will see. Knowing the documentation requirements for 99285, a comprehensive emergency department exam, provides us with the basic knowledge to complete our charting on the complex cases that we face daily in our practice. Is there any easy way to remember the requirements, Chris?
Well, here in Texas, we're familiar with shotguns, so we use the mnemonic 4-10-28, patterned after the two smaller shotgun gauges, a 410 and a 28 gauge. That represents 4+ elements in the history, 10 or more review of systems reviewed in our review of systems, 2 elements in the past medical, social, or family history, and at least 8 organ systems examined in our physical exam.
But what about MDM, or medical decision making?
Though we can't bill for a comprehensive 99285 exam without a well-documented HMP, in fact, most high levels of billing and coding are determined by MDM, or medical decision making. So not only do you need a well-documented HMP on your sickest patients, you need to thoroughly document your medical decision making. The level of complexity of medical decision making will almost always determine the highest possible code, or lack of your documentation can cause your level to be downgraded when a coder evaluates your chart.
So to raise the level of a 99285 comprehensive encounter, your MDM documentation will need to express high complexity in all 3 areas that coders evaluate. The first area is the number of diagnoses. Make sure to list not only your primary impression or diagnosis, but also include comorbidities.
The second area in medical decision making is the amount and complexity of data to be reviewed. Specifically, we are talking about lab. Examples include a CBC, BMP, lactate, VBG, EKG, chest X-ray, CT scan, and so on. This also includes your interpretation of abnormal lab results, your interpretation of X-rays, and your reading of the EKG.
The third and last area of MDM is the risk of complications and morbidity mortality. Obviously, it helps to document those risks or concerns so that the coder knows what you're worried about. That's probably enough for now. Let's review.
About 85% of your charges will come from the basic EM codes, 99281 through 99285. A comprehensive 99285 chart will require a minimum of elements in the HMP. We can remember that as 41028.
A comprehensive 99285 chart will also include your medical decision-making documentation to express high complexity in all 3 areas that coders evaluate: diagnosis and management options, amount and complexity of lab and image data, and risk of complications, morbidity, and mortality. That's it for now. Thanks for watching, and stay tuned for more episodes on billing and coding, the reimbursement basics for emergency physicians, and what you need to know.
Signing off from Dallas, Texas, this is Chris Dameyer
And Jennifer Dickinson. Thanks much.